standard.
Since we've got some time off, we're going to do what we originally were going to do, and we're going to go through some of our equipment. This is the first bag. It's called our Airway bag. Inside it has all the different Airway equipment that we use and the intubation equipment for James when he has to put a tube down somebody's throat.
My favorite.
They have them sealed for us. That way we don't have to bust them open. And if we don't use them, then they can just leave them on the truck for the next crew to take. There you go. We'll hold it. In this upper pouch we have masks, we have nebulizers, we have O2 for your nose. This is called a non-rebreather. Basically it just goes over your face. And you can bump the O2 up to what, 25 I think is the highest we go?
25, yep.
Nebulizers for people with asthma. Where in this thing do we keep the ring cutter? Because I said I was going to pop that thing out and check it. Oh. Think they'll be mad if we bust open the Easy IO?
I don't know. That's a good question. Ring cutter.
Ooh, there we go. So
I've never seen it in plastic before.
If I remember correctly, you're supposed to be able to slide this underneath your ring, and you make sure you make good contact with it. It's supposed to be diamond hard, and you use this. Oh, the key's missing.
Oh.
The turner is missing on it. And the, oh, thank God we busted this out. Because look, it does, when you turn it, the blade's not even moving. So, oh, I'm so glad that we opened this up. It's my fiance texting me. Oh, she's writing flashcards for her brother. Okay, here's the intubation kit that we use.
373.
Here we have all the different little pieces. We have the tubes that we stick down your throat, depending on size. I forget, is that the King Airway? Is that the not the?
No, that's the regular Airway.
That's the regular. Where are we keeping the King Airway?
I think where the combi tube used to be.
Ah, where the combi tube. Okay, that's the That's supposed to be the last resort thing. We have different kinds of blades. We have the Macintosh and the straight. We only carry 2 sizes of each.
Mm-hmm.
Oh, sorry, 3 sizes of the straight. So, I loathe to see the guy that's that big. That would take that down his entire freaking throat. Look at that. That is. It's supposed to go like. It's supposed to go all the way down there. That's horrifying. I don't think I've ever seen that one used. We have the different the Easy Glide jelly that this package is leaking for our patients. What is that one called?
These?
Yeah.
These are called the Miguel forceps.
Miguel forceps.
That's what I used to go after that chunk of steak you didn't quite finish chewing.
Yeah.
And we just got a call, so we'll talk to you later.
There we go. Alright, so James is going to tell you about the Easy IO setup that we have here.
So this thing here...
What's the Easy IO for?
This thing here is called the Easy IO. It's a little hand drill. This is when we have a very critical patient that we cannot get an IV in their arm or their feet, or we can even do some in the neck there. And we don't have any more time to waste trying to find an IV because we got to get them medication. We do what's called an IO, which is interosseous, meaning it goes into your bone. So it goes into your shin here, right below the knee.
Where else?
It can also go into your shoulder up here, and it's not a whole lot of fun to do to people, or I'm sure not for them to get. But most of the patients that I do this on are not currently alive. We're working on trying to fix that. And so here's one of the needles. That one goes into your shoulder. That's a big needle there. And then this one's a pediatric needle. And then we got the ones that go into your leg. I'm not going to open these, but you can see it clips on there. And you just hold it onto the skin, pull the trigger, and it sinks straight into your bone. And then we can give you medication just as if it was in your vein. Cool little device.
Yeah. All right. So what else we got here? We kind of went through the intubation bag here. So other things like we carry in here is a bag valve. If I could talk, bag valve mask. And basically, this piece right here is this end attaches to the O2, and then this end attaches. You can see it right here. It's got the face mask that attaches to the end right here, or on the other end, right there. Hold on. This will be larger. Oh, no, never mind. We're going through stuff. There we go. Because they're always telling us to actually play with this stuff, and we need to keep our skills. Basically, you take this part, and you have to form a seal on your face with this. But there's a new way to do it. I remember them saying. But basically, you do a C, and this is used for people that can't breathe, won't breathe, having trouble breathing, and you can pump this up with all the O2 in our major tanks. It's basically all it is. It's a bag valve mask. If I can only talk. Bag valve mask. Let's put that back away. Bring it on down.
When we go into your house, we actually carry 2 tanks of oxygen. You don't always see them, but you know, sometimes we leave the stretcher outside. But we always have these gear bags here. You can see down here underneath the bag valve mask, we got 1 tank of oxygen there, and then one of them is strapped to our stretcher there. So like I said, always 2 on scene. And then you've seen the little nozzles in the truck here. Big O2 tank in the truck.
I forget what this is.
That connects to
tracheal suction catheter tip. Our bags are just full of goodies. It's just.
I think the King Airway's on the other side.
Yeah. It's like a TARDIS. It's always bigger on the inside. All right. Here is the King Airway. No, this is the Salem.
This is the
Salem
OG.
Dual lumen stomach tube.
The OG tube. These are our King Airways here. It's
most
a new device.
Switching to the King.
Yeah. When I went through school, though, I did not learn about the King Airway. Well, I learned about it. I did not learn on it. Did not get to use it in school.
We used to have the combi tube up until.
Combi tube was loved and used by our system here, but this is just as good. It's a blind insertion airway device, so everything you saw in that intubation kit, I don't need for this. This, I just lube it up, shove it down your throat, and it's just supposed to go exactly where it's supposed to, and you can just start pushing oxygen through it so people can breathe.
This is the dummy tube. Basically, this is the thing you use last. If you can't use the intubation kit, then you use this. Alright. I think that about covers everything that's in here. There's some minor things like
There's some bandaging stuff.
Bandages, a SAM splint.
Yeah.
We'll demonstrate a SAM splint at a later time.
When we get to the trauma bag.
Yeah. What? When we get to the trauma bag or when we get to the cabinet here?
Yeah.
Basically, it's shears and some emesis bags, and that's it. Like, here's the SAM splint right here, and we'll go through that at different points. But James is making faces and he's sneezing.
Trying to sneeze quietly, it's hard.
It is very hard to sneeze quietly. Well, that's it for going through an airway bag at our company, and any questions, just ask. Bye.